In this video, I'm going to show the most overlooked cause of sciatica and how to fix it. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. If you're dealing with sciatica that's made worse by sitting or through activities like walking or going up and down stairs, definitely check this video out because you may be experiencing an overlooked cause of sciatica, which is known as deep gluteal syndrome. Deep gluteal syndrome is a muscle injury in which pressure builds in the glutes or the buttocks that can compress the nearby sciatic nerve as it travels through this area. What usually causes this is a blend of weakness and tightness in the muscles that can lead to strain, inflammation, and symptoms such as pain, numbness, and tingling across the buttocks, into the hip, down the back of the thigh. A hallmark sign as your symptoms get worse the longer that you are seated, because this is a compression injury. So to make getting relief easy, I'm going to break the video up into 3 separate parts. While each part is different, they are meant to work together and also in order. So make sure to go through all the exercises and use what works best for you. With that being said, let's get started. So in the first part, we're going to focus on a warm-up exercise. I cannot stress this enough. If you're dealing with a muscle injury, the first thing that you need to do before anything else is warm up that muscle to make it where you're bringing blood flow, circulation into the area to help promote healing, but also make it less likely that you further aggravate that injury through activity or exercise. So here is a really good one that you can do in bed or on a floor. This one is perfect to do first thing in the morning if you're dealing with a lot of pain. Just lie flat on your back like this. You're going to have your legs roughly hip width apart, knees bent, feet flat. The first movement I'd like to do is just to take my heels and just press them down into the bed until I feel a light activation of the buttocks. From there, what I'm going to do is take my knees and swing them towards one side, keeping my back flat, just moving through my hips and through my pelvis. As you do this, you're going to feel a really good stretch form in your hips, your pelvic floor, and also into the lower back. Only go to a point where it is a light stretch. If you start to feel any pain or discomfort, especially down the leg, back off. And at that point, you're going to hold this for a second or 2. From here, what we're going to do is swing towards the other side. I call this one the windshield wiper for good reason. But you're going to repeat this on both sides for about 5 to 10 repetitions. And with each repetition, try to build into it just a little bit more. So the next movement is called the butterfly. And this one is really going to help open up the hips and relax the glutes. So what I'm going to do this time around is put my feet together just like this, and then I'm going to just gently press my heels into the bed or the floor till I feel that light activation around the buttocks. From here, I'm going to take my knees and I'm just going to press them downward as much as I can until I feel a really good stretch form on the inner part of the thigh that works towards the groin into the hips. Again, only towards a light, comfortable stretch. Once you feel that, hold that for a second or 2, and then what you're going to do is bring your legs together just like this. So just like a flapping motion of a butterfly's wings, we're just going to go down and up like this for 5 to 10 repetitions. And again, with each repetition, challenge yourself to build into this one. It's a really good exercise. So the last one is definitely going to be the most intense of these 3 stretches, and this one's really going to help target the glutes and another muscle called the piriformis. So what I'm going to do is take my painful side, like let's say I have a lot of right-sided glute pain and sciatica symptoms going on. I'm going to take the painful side's ankle and place over the other side's knee. So when I look up, it should look like a figure 4. From here, what I'm going to do is take this bent knee and just slowly press it away from me. Don't use your hands with this one. Instead, use your leg and hip strength to press into it. As you do this, you should feel the glutes start to activate. If you don't really feel it too much, probably this back leg is a little bit too far away, so just slide this back towards you like this until you start to feel it. I'm really feeling it over my glute right now. But press into it because this one is going to offer a very deep stretch. Hold this comfortably for about 5 seconds, release it, and then repeat this 5 to 10 times. But go through all of these movements. You're probably going to find that one just offers the deepest stretch, like it just really is attacking tightness. And at that point, throw more repetitions in until everything is nice and loose. So after we're done warming up the muscle, we're now going to move on to the most important part, strengthening exercises. The main cause of deep gluteal syndrome is because of weakness that builds over time that leads to muscle strain. So this could either be through sedentary lifestyle, too much sitting or doing a new activity that overwhelms the glutes, such as going out and gardening or doing a whole bunch of landscaping for the first time in a while. So here's a really good exercise that you can do daily to help strengthen the buttocks. This one is called the wall slide. What we're going to need is a smooth wall. So just start on your side just like this with the painful side upward towards the ceiling. So I'm going to demonstrate what to do if you have left-sided sciatic-like pain. What you want to do also is support your head just like this with your hand and just put your whole backside flush against that wall. This bottom leg, we're going to bend the knee and then just take our foot right here and press it into the wall during the exercise for support. So let's try to straighten this top leg as much as we can, and what I'm going to do is just gently press my heel into the wall to the point where I feel a light activation of the buttocks around the hip. From here, I'm going to hold this position and now slowly slide my heel upward like this towards the ceiling. Do this one slowly, because the more that you go up, the more that you're going to feel a deep activation throughout the glutes. You want to go to a point where it is a comfortable activation. If you start to feel any pain or discomfort, back off and come down a little bit. From here, you're going to hold this position for about 3 to 5 seconds and then slowly come back down. The key is, though, fight your leg weight coming down. You're going to notice that it hits the muscles a little bit differently. So we're going to resist going up and then also going down. I like to do this about 5 to 10 times with each repetition, just building into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. So you can take this one to the next level and challenge the glutes even more by throwing in some hip rotation. So what you want to do as you raise your leg up, turn your foot outward as much as you can, putting the hip into external rotation. This is a lot more challenging, and those muscles are really going to fight this movement. So go up with it, hold it, and then when you come back down, turn your foot inward like this, putting the hip into internal rotation. So give that one a try when you feel ready. So with this one too, if you would like to make it a little bit more challenging, all you have to do is scoot away from the wall so you won't have that support. Just make sure that when you do this exercise to try to keep your leg in line with your body, but give that one a try if you would like to have a little bit more of a challenge. And I would recommend throwing in a couple sets on the other side, even if it doesn't hurt, just to help keep everything in balance. So here's another really good exercise that you can do daily to strengthen the glutes. This one is perfect to do in addition to that first exercise because it's going to target a lot more muscles, including the hamstrings and the core muscles that support the glutes, but it also can serve as a replacement if you feel like you need to do something in bed. So this one right here is called the glute bridge, but I'm going to show you how to take it to the next level. What we're going to do is start lying flat on our back in bed or on a floor. Just have your legs roughly hip width apart, knees bent, feet flat. The first thing that you want to do is brace your core muscles. It's kind of like when somebody pokes you in your stomach, how you tense up. Mimic that and hold it during the exercise. It will help protect the back. From here, I'm just going to take my heels and gently press them downward into the bed or the floor until I feel a light activation of the buttocks around the hips. Once we feel that, we're going to hold that, take our hands, put them off to our side. The first movement is pretty straightforward. We're just going to lift our hips and pelvis upward to the point where our body is in a straight line from our knees to our hips to our shoulders. In this position, you're going to feel a ton of muscles start to fire. The core, the back, your butt, your legs, everything that helps support this area. So we're going to try to hold this one comfortably for 3 to 5 seconds, release it, take a breather, and then repeat this 5 to 10 times. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it feels like it's helping out, it's really targeting those muscles, you're more than welcome to throw in another set or 2. But this is how we're going to take it to the next level, focus on some more muscles, and hopefully get some more relief. What we're going to do first is what is called a hamstring walkout. So it's pretty similar to this bridge movement, but what I'm going to do is just slowly walk out with my heels like this. The further that you go out, the more that you're going to feel the back of your thighs really start to engage. So give that one a try for about 5 repetitions. You can also do what is called a clamshell bridge, which is going to target the glutes a little bit more. So for this one, we're going to put our feet together, gently press our heels downward into the bed until we feel a light activation of the glutes. We're going to take our knees right here and just press them downward towards the floor until we feel a really deep stretch form on the inner part of the thigh that works towards the hips into the glutes. Once we feel that, we're going to hold that position and then lift up to do the bridge. You should really feel it on the outside of your hips. This one helps target the gluteus medius, which is a big instigator of deep gluteal syndrome. So feel it right here on the outside of your hips. Hold this 3 to 5 seconds, release it, try to do that about 5 to 10 times. But go through all of these movements. You're probably going to find that one just feels the weakest. At that point, treat that like your weak link and throw more repetitions in to make sure that you strengthen those muscles. So in the last part, we're going to focus on stretching. Stretching is great to do after strengthening exercises to keep everything loose and also help avoid soreness. But you can pretty much stretch anytime that you feel tightness or pain starting to build across the glutes. I want to show one that you can pretty much do anytime, anywhere, because you can do this one seated. What we're going to do is start with very good upright posture. Just have your back as straight as possible. Whatever side that you're having sciatica, let's say that you're having it on your right side, you're going to take that side's ankle, place over your other side's knee. So when you look down, it should look like a figure 4. If this position is extremely difficult to get into because you have a lot of tightness across your buttocks, to make it a little bit easier, take this other leg, straighten it out in front of you, put your ankle over the other side's shin. You can grab your pant leg or in front of the shin and then slide it up into position. But for a lot of people that are dealing with deep gluteal syndrome, this position with gravity just pulling your leg downward, it's probably going to be pretty intense. So to be able to control the stretch, just take your hands, cup around your knee, and what you can do is lift up on your knee to lessen that stretch, but you really want gravity to take it down as much as you can. If you're in a position where it's not overly that tight and gravity can just take it and it doesn't feel like that deep of a stretch, what you want to do at that point is deepen it by taking your knee and just pressing it down towards the floor using your leg and your hip strength. Don't use your hands. You should feel a deep activation of the glutes across the hips. Once you feel that, you want to hold this right here for about 5 seconds, release it, and then repeat this 5 to 10 times. And with each repetition, try to build into it just a little bit more. So if you feel like you need even a deeper stretch, what you can do to be able to get that, as you take this bent knee down, just keep your back straight and then lower your chest downward towards the floor. Do this one slowly, because if you don't feel a deep stretch across the hip right here, you definitely don't have tight glutes. But I like to hold this one again about 5 seconds, release, repeat that about 5 to 10 times. But if it is helping, you can throw in as many repetitions as you like. So the next stretch is going to hit the glutes and also across the thigh right here a little bit differently. And this is one of my absolute favorite stretches to do to get instant pain relief from sitting too much. So this time around, I'm just going to take my fingers, interlock them, cup around my knee, and I'm going to pull this bent knee across my body towards the other side's shoulder. What you should feel is a deep stretch form on the outside of your thigh that works towards the glutes, right here on the outside of the hip. Hold this one for about 20 to 30 seconds. Release it, and then repeat this 3 to 5 times. But go through both of those movements. If you do find that one is just targeting tightness a little bit more, at that point throw some more repetitions in. And I would throw a couple sets in on the other side just to help keep everything nice and loose. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.